Welcome to the topic pneumonia part 3. We have seen part 1, we have seen part 2. Today is part 3. We are going to address the two questions. We have answered the definition of pneumonia, we have seen the causes, we have seen how you can diagnose it. Let's see the consequences or complications of pneumonia. Then we see how it is treated and prevented. Okay, when you check the complication that comes with pneumonia, there are many. Some of them, it will be one, pleural effusion. What is pleural effusion? It's an inflammation that leads to exudation of fluid in the pleural space. This is the part which helps on breathing in and out. The lung will expand and fill this space. This space is called pleural space because this membrane out is called pleural. Now, this space needs to be just free, empty, without any fluid inside. Now, when there is pneumonia, there is a possibility that some water will be start leaking, exudation coming until it becomes too much. If it is both sides, then it affects both sides. That's one of the complications. The water will be too much, then it will compromise the lung function. When the doctor comes and do the exam that we saw, or percussion, or auscultation, he will be or she will be able to hear that there is a problem. Now, when you put a needle here, you might drain fluid. It can be just fluid, pleural effusion. Sometimes it can be pus. Another complication can be empyema. This is the pus we're talking about. Empyema, instead of having just fluid, it will be pus around. That's one of the complications. Or it will cause necrosis, where the tissues that are responsible for respiration become necrotic. Another complication is where this now, the fluid, the tissues get damaged. In the healing process, they collapse each other, they form a complex, become like an adhesion, which will form what we call fibrosis. And the expansion of the lung will be a problem because it is already hard. It's a fibrotic tissue. Those are the complications, including abscesses, formation of abscess. This was a CT scan image that's showing where abnormal holes where the bacteria will come and destroy the tissues that are supposed to be functional in the lung, particularly with a bacteria called staphylococcus or streptococcus. Look what they do. They will come and make holes in the lung. A tissue that has been normal then get destroyed. That's a complication. On epidemiological aspect, in the social aspect, you find that pneumonia is a killer. That's why we decided to talk about it, as it is among the top 10 killers. It is killing adults and children. If you count 100 children who are sick, and you sick from pneumonia, you find that 15 out of these 100 children will die. It just means that the mortality rate from pneumonia is very high. Globally, when you check worldwide, it does kill many people. You can see in 2017, it has killed 880,694 children. It is the second leading cause of hospitalization in the United States. In 2011, there were 5.6 million cases reported in the United States of America. It was the sixth leading cause of death in that year. Weight killed 6,000 people. And 10 of the patients who were, when you count all those who were sick, it killed 10% of them. This shows how much this condition is severe. How do we treat this condition? The treatment is into two parts. There is a treatment with medication and there is a preventive measures. Let's start on the medication. The medication, particularly pneumonia caused by bacteria, it is very sensitive to penicillin. Whether ampicillin, benzylpenicillin, amoxicillin, all of these are in the family of penicillin. So when you give ampicillin and you add gentamicin, it works very well. Ampicillin, benzylpenicillin, gentamicin, you give them IV. If the pneumonia is not very severe, you can give amoxicillin, which is tablets. These are the options that you can go for immune competent people. But if there is now immunodepression, we are talking about the soldiers of the body are decreasing. Might be HIV, might be cancer, might be advanced stage of any chronic condition, diabetes. We need to add another medication called tremoxazole. This is Bactrim, and you have to treat complications. Nota bene, you don't give all these medications at the same time. You take one choice, then you add Bactrim. The same here, you will give either ampicillin, gentamicin, or benzylpenicillin plus gentamicin. Okay, the preventive measures now, apart from vaccination, which is very important. You have heard about influenza. Influenza can be very severe if the person is not vaccinated and pneumonia comes on top. It will be very difficult to manage. 2, washing hands is very important. We need to wash hands regularly. We know very well that most of times our hands where we touch, we carry bacteria. In case we put them in our mouth, then we put bacteria that might cause pneumonia as well as other types of infections. Eating right with plenty fruits and vegetables, minimizing contact with sick people if possible, getting enough rest, sleep, and exercises, they help on boosting immune system. Quitting smoking. Smoking is the enemy of the lungs. We need to agree on that one. It is well documented. Smoking is not good for lungs. Another thing that is emphasized, breastfeeding. If you have a child, a baby, particularly in the first 6 months after birth, the child needs to be breastfed as you are giving antibodies to the baby. The baby, when is born, does not have antibodies for him or herself. That's why they need to be vaccinated. Vaccination is very important. In addition to that, breastfeeding is very important. We need to improve indoor air quality, frequent hand washing again, and we need to drink safe, clean water. Good nutrition is very much emphasized, particularly for children. World Health Organization is emphasizing on reducing exposure to indoor air pollution. Adequate nutrition again, immunization. It's very important. Avoiding smoking near children, also for adults. Improving housing condition. Wow, this is very good. A good message that we need to hear and put in practice. We thank you so much to continue to navigate through this health education, health promotion. More topics are on the website. Always, if you have a question, a comment, you are welcome to send an email on our email address as it is provided. Thank you so much.